Thank you for downloading Children's Pedcast, a conversation about pediatrics with Children's Hospitals and Clinics of Minnesota. My name is Jimmy Bellamy, and this week my guest is Robert Doss. He's a clinical neuropsychologist and the co-director of the Pediatric Concussion Program at Children's Minnesota. Doss spends time on both our campuses in Minneapolis and St. Paul and works a lot with the patients and the parents of the patients who have experienced concussive symptoms or who have been suspected of experiencing concussive symptoms. He does evaluation and treatment of these patients. This was a topic that is extremely important to me because it affects so many people, and it can come on in a variety of ways. We cover the recent U.S. soccer ruling of children ages 10 and younger not being able to head the ball during games. And we talk about the upcoming film Concussion, starring Will Smith. Will Smith portrays Dr. Bennett Amalu, a forensic pathologist who was the first to publish findings of CTE, chronic traumatic encephalopathy, in American football players. The thing that's so unique about this is that every individual reacts differently to a concussion, so it changes the treatment. People can have a more severe reaction to less of a blow to the head compared to others who may not experience symptoms from a similar or more severe strike. And we talk a lot about that. We talk about the work that's been done in recent years, and we talk about the work that is underway as we speak when it comes to understanding concussion and understanding head trauma. You can find us on the web at childrensmn.org. And from there, you can go to the Services tab and find our neurology program and our pediatric concussion clinic. We're also on Twitter at childrensmn. The same goes for Instagram. And for this show, you can listen to us on iTunes, where podcasts can be found. Pretty much any podcast can be found there, so look for us there. And while you're there, please rate, review, and subscribe. That helps us get seen by more people, or heard, if you will. We're also on Podbean, Stitcher, and Vimeo and YouTube as well. What do we do with the pediatric concussion program? What are the things that are going on, whether it be on a daily basis or a weekly basis?
Mm-hmm. So the Pediatric Concussion Program at Children's is a multidisciplinary based program that's housed within neurosurgery and neurology, and it's a program that includes providers that are nurse clinicians, neuropsychologists, pediatric psychologists, physical therapists, occupational therapists, neurology specialists, and so we really take a very wide view of in the care of the patients who have concussion. The average age of the patient in our clinic is 13 and a half, so anywhere from 5 years old all the way up to 18, generally speaking. So it's a program where we follow the patients throughout their recovery, and then get them back to school as quickly as we can, get them back to their sporting activities if that's what they're involved in a very safe manner.
When it comes to pediatric head trauma especially, what kinds of steps does the clinic need to take that maybe people who are seeing and treating adults don't necessarily have to take?
So it is true that in kids, the brain is still developing. There's still what's called myelination going on, and in particular, till the age of about 22 is what we know. And there's a tremendous amount of neuronal growth in the early teenage years, later childhood years. And so we always have to take that into consideration when we're dealing with kids who have concussions, because these concussions are occurring in the developing brain. And that actually may be a large factor in why kids appear to take longer to recover. And they can be more symptomatic after a concussion. And though we don't really know the exact mechanisms that may contribute to this, what we really do know is it takes longer for kids to recover.
There's still more and more information to be learned about that area of the body. And to me, that's fascinating. And it must make your line of work so enjoyable from the sense of no day is really the same as another, that there must be new stuff popping up all the time.
Well, it really is. I mean, it's going to be a fascinating, the next 10 years are going to be fascinating, especially as it relates to pediatric neurology and pediatric head trauma. Lots of what we know about concussion and what happens to the brain has either been done on non-human animals such as rats and mice, or it's been studied in adults. And we're really in our infancy about understanding how a concussion occurs in a child and what the changes in the brain that occur in that developing brain, and then what happens as far as recovery goes. So I think that there's going to be really an explosion of knowledge in that area. And it really is quite fascinating because you are dealing with a very dynamic process in a child's brain that's very different from an adult.
Have you been satisfied with the amount of respect that head trauma has received in the past decade plus? I remember as a child, it was considered to some people a badge of honor of, oh, I've had this many concussions from hockey, or I had this many from football, where now it's being treated as the serious matter that it is.
Absolutely. I believe that there's been the attention that concussion has gotten over the last 10 years, I think is very good for the health of our children. In the sense that I can tell you that as a parent of hockey and football players, I believe that there's a much greater awareness of concussion and what to do with it at the parent and coach level. I think from what I've seen with changes in rules of play, for example, in hockey, I think that there's more respect on the ice for your opponent and your teammates, and I think that there has been a definite improvement in how kids are treating each other, how we're recognizing the symptoms of concussion. We've got a long ways to go, but I think that we've made some great strides. But again, there's going to be a lot more that we need to do.
We've talked about in the news, hearing about CTE.
CTE, or chronic traumatic encephalopathy, is now a recognized neuropathology, just like Alzheimer's disease or Parkinson's disease is. In fact, there was the National Institutes of Neurological Disorders and Stroke had a consensus conference earlier this year where neuropathologists and brain scientists got together to really kind of hammer down and decide on what is the criteria for this neuropathology called CTE. And so, as I said, they came to a consensus. It's distinct from something like Alzheimer's or Parkinson's, and it seems to be directly related to head trauma.
Is it very possible that something experienced either in youth or in athletics in general from any level could result in something decades later?
It's certainly possible. So what you're speaking to are the need for longitudinal studies, and to try to understand that is what we're lacking in the understanding of CTE right now. What is concerning is that CTE has been identified in a number of young athletes, and these are individuals who've had concussion histories for sure, but it's the age. I think there's a 21-year-old, an 18-year-old, and so we really need to get a better understanding of what is the nature of the physical injuries that these people have, what's the risk of it, what's the relationship between repetitive head trauma that doesn't constitute concussions, but it's just repetitive over a long period of time. What's the nature of that sort of injuries, and potentially the development of more chronic neuropathological changes. So there's really a lot that still needs to be done in trying to understand this disorder.
Is it possible that people are born with being more susceptible? I mean, I understand that a blow to the head is a blow to the head, but are there people who may be born with something or without something that would make them more susceptible to head trauma or to a condition due to head trauma?
Yeah, and so what you're speaking to are genetic vulnerabilities. And just like we're trying to understand the genetic vulnerabilities that could be associated with Alzheimer's disease or Parkinson's disease, we're going to have to go that route with CTE as well. So the answer to your question is that there very well may be vulnerabilities that are genetically based that could potentially predispose one person to the development of something like chronic traumatic encephalopathy or not. One of the things that's been pretty interesting in head trauma research is these paradigms of research where they're putting sensors in athletes' helmets, whether it's a hockey player or a football player. And some of the things that they've discovered is that they'll be able to quantify the force of the head traumas, or the head hits that an individual has, the angular changes, the acceleration, deceleration that occurs, and so they'll be able to be able to quantify these, and then they'll be able to correlate those with how an athlete feels after they've had that hit to the head. And something that has come out is that there are individuals who sustain hits to their head that are quite significant, yet they don't have any symptoms whatsoever, and they feel just fine. On the other hand, there's another individual, an athlete, will have what would be considered a relatively minor hit, and they report some symptoms. And so what I'm speaking to are individual differences in the vulnerability to these hits and how they affect a person. So not only are there potentially genetic predispositions and vulnerabilities, but there's also just individual differences in how an individual's brain will respond to hits.
Based on what you do for a living, are you able to enjoy sports such as boxing or MMA or even football or hockey at a high intense level?
Well, I already had mentioned that I'm a parent who's got kids who play hockey and football and baseball. So the answer to your question is I'm not a real fan of boxing and MMA sort of sports. Just because the risk of concussions and other sorts of head traumas are just so high in those sports, because it's
the object of the sport is to strike an opponent in the head, unlike where football it happens. Yeah, I can see that.
Yeah, and potentially render them render them unconscious.
Exactly.
But when it comes to football, soccer, and all the other sports, I'm an active fan like everybody else. I always get into this conversation in the sense that there is so much that sports is that it's good about sports for kids. And, we have a childhood obesity epidemic in this country. And I think getting kids out and active and involved in sports is very important for lots of reasons that include social, physical, and mental. And so I think what we need to do as a country, as parents, as coaches, as athletic directors is to really work on preventative measures, working on rules and how can we make the sport safer.
Recently, U.S. Soccer decided to ban heading for kids ages 10 and under. Is this something that you think is a good step, a positive step?
I think it's a reasonable step. There's definitely a two-way street in this sort of rule change, in the sense that some people will say, if you don't teach kids how to correctly head at a younger age, they'll do it incorrectly and potentially be more susceptible to injury at older ages. On the other hand, if you can prevent the occurrence of repetitive head traumas at a younger age, then I think that's good, particularly as we've talked about in the developing brain. What I can tell you, though, when it speaks to heading and in soccer injuries in particular, is that there was recently a study that came out in pediatrics that looked at high school soccer injuries, concussions, and what was the kind of the mode of injury in those sorts of concussions. And what they found is that it was the act of heading that led to the most concussions, but it was not heading the ball that really was the most important factor. It was actually body-body contact. So heads hitting heads hitting shoulders, head hitting the ground, that resulted in the concussions. So I think in order to really address concussions in the sport of soccer in particular, it's more important to get a better understanding and to prevent these strong body contacts that will occur.
You mentioned your children play sports. Have you noticed, and you even mentioned that you think players are respecting their opponent and their teammates more now. Have you been able to see that in the years? I think within the past decade, hockey has started to put the orange stop sign on the back of jerseys. Have you seen fewer cheap shots, fewer blows to the head in youth athletics?
There's been a lot of rule changes in hockey with regards to penalties for more significant infractions, and I think that has changed the way kids have played. There's a lot of discussion with kids about safe play, respecting your opponent. And from my view in youth hockey, and I would say this even at the collegiate level and high school level, that I think that there's less dangerous play going on. I mean, that's just my observation as a fan and as a parent. However, when kids get injured, it's not usually due to maliciousness. It's just due to a bad decision, and that happens in a very quick moment of time. And there's a lot of unfortunate injuries that aren't due to any infractions at all. Falls and collisions occur all the time in sports.
I've seen the full 90 headgear that exists now. Do you see making headgear mandatory as a possible step in the future for soccer, youth soccer in the United States? And do you see that even as an alternative to, say, this banning of heading for 10 and younger?
So here's what we know about headgear and concussions. Hockey helmets, football helmets, they do a very good job of preventing serious brain injuries. And what I'm talking about are bleeds in the brain, skull fractures, things like that. They are much less effective in preventing concussions, and that simply has to do with how concussions occur. It's not necessarily the direct blow to the head that leads to the damage in the brain that results in the concussion itself. It's more the twisting and turning of the brain inside the skull. And it's really, the helmets can't do anything about that. So they can prevent the skull fractures. They can prevent the more serious bleeding in the brain, sort of brain injuries that can occur. But so I'm not sure how, having, if there's a high incidence or problems with skull fractures and brain bleeds in soccer, then helmets, may be something to think about. But that's not really the case.
Okay. I
always tell people, if you're familiar with the head restraint systems that NASCAR and race car drivers use, that attach their helmets to a breastplate that is around their torso, those are the sorts of helmet systems you would need in football or hockey or soccer to really prevent significantly concussion, because those head restraint systems prevent that twisting and turning of the brain inside the skull.
Okay.
And so you obviously can't have that in a sport like football or soccer, where there's so much turning, your head's turning so much to be part of the play and so anyways, it's the there's not there aren't concussion-proof helmets, and I think as long as we have these sports and playing with helmets, we're going to continue to have concussions.
Is it that everything is moving and then you have that stop and the brain continues and makes contact with the skull? Is that what occurs?
That's part of it, but there's also your head is on your neck, which pivots in pretty much every single direction, and so when that head moves, the brain can twist and turn inside the skull And it's those rotational forces that really are what causes the symptoms of a concussion. And so it's actually what's going on inside the brain itself is that there are many, the axons or the brain cells have long parts to them, and those are what get stretched and changed when you have that twisting and turning.
When it comes to the kids you see with the concussion program, have you seen an increase in numbers over the years? Have you seen a decrease at all, or has it stayed roughly the same each year?
So we've had, there's been a significant increase of assessment for concussions over the last 10 years, there's no doubt. I can tell you that the state epidemiological unit here in Minnesota, led by Leslie Seymour, has been tracking these numbers. And in 2014, there were 5,000 kids diagnosed with concussions in the state of Minnesota. It's really a matter. One of the factors is clearly there's just increased awareness. Kids are getting into the healthcare providers like they have not in the past. I also think an argument can be made is that kids now in youth athletics are stronger and faster. There are kids who play sports year-round. There are kids who are involved in conditioning programs like they haven't been. I know when I was a hockey player, we didn't have conditioning programs, and we certainly didn't play year-round. And so I think the competition level has greatly increased, and with that, the speed of the game has increased. Whatever sport you're talking about, I think it's involved in all the sports, and so I think that there is an increase in concussions because of that, and now the major factor is just the awareness. If
you could have an area of focus covered when it comes to concussions and head trauma in the next decade, what kind of breakthrough would you like to see, or what would you want to specifically learn more about? One of the things that really need to get a handle on is what is happening into the pediatric brain, in a child's brain when they have a concussion. And so I think that in the next 10 years, with advanced neuroimaging procedures, potentially blood biomarkers, we're going to have a better understanding of what actually occurs in the brain. And I think that's going to be very important because we need to have a better understanding of, after a child has had a concussion, what are the recommendations? How long should they be out of sports, for example? Right now, it's mostly focused on symptoms and how they're feeling, and we don't really have biological information to help us make those decisions. And so I think, again, within the next 10 years, we're going to have a lot more information about that because there are studies going on. And in fact, here at Minneapolis Children's and Children's Minnesota, we are involved in an advanced neuroimaging project where we're recruiting kids out of our concussion program to do advanced neuroimaging in magnetoencephalography. This is in collaboration with the University of Minnesota over at the Center for Magnetic Resonance Research. So the goal of this research project is to try to identify and understand what is happening in the brain right after a concussion has occurred. So we're recruiting kids who've had concussions to go through this advanced neuroimaging, and we'll be able to. And this will occur hopefully within 10 days of their injury. And then as they recover, we'll have them come back in probably 30 to 45 days later and do some imaging to see what's changed in their brain over the course of their recovery. And then we'll be able to kind of evaluate their symptoms while they're recovering and how it relates to the brain imaging. So we're going to be, and this is imaging that you can't really obtain clinically. It's certainly research oriented, and I think it'll be able to tell us some things that we just don't know right now about the brain after it's had a concussion. Are there things in the works for being able to reverse any damage that is done due to a traumatic brain injury, due to a concussion? Those sorts of research pursuits are definitely going on. I mean, there's ideas about certain medications that might be helpful to kind of
help or interfere with some of the neurochemical changes that occur in the brain after an injury has occurred. But they're all really, again, in their infancy. In the next 10 years, we may have some more information about that and potentially some treatments that could help with that.
A lot of the concussion talk in media the past 10 plus years focuses heavily on football. And this Christmas, the film Concussion is coming out, starring Will Smith, who plays Bennett Amalu. He was
the one who really identified it as a potentially prevalent and serious problem in particular in retired NFL football players.
I saw the documentary Head Games, which covers some former NFL players and a former boxer who had their brains looked at after they had died, and they were all have found to have CTE. Are there things that can be done while someone is alive to detect CTE, or is this only when someone is deceased?
There's some very interesting lines of research, again, with advanced neuroimaging, in particular a procedure called positron emission tomography that looks at neurochemicals in the brain that could potentially identify a vulnerability to CTE, or potentially even the neuropathology itself. There's a very similar line of research going on in Alzheimer's disease right now. And so it kind of follows along that line of research. And so it's very well possible that they could come up with some markers that could be identified by these PET scans that could identify the neuropathology itself, and potentially what they're trying to do in Alzheimer's disease, what they could also do in CTE, is to develop a scan that could look at the vulnerabilities to the development of this neuropathology.
When it comes to this film releasing at Christmas, is this a good opportunity to raise awareness for what we do at the clinic? As far as, do you think this will bring more people in thinking about it, or is that hard to imagine it being even a more heightened awareness than there already is for concussions?
Well, I'd say concussion has got a pretty heightened awareness as it is right now. It's possible that it may heighten it even more. I wouldn't expect, for example, the referral patterns for our program to change very much in relation to the movie, but it's hard to say. I mean, we'll have to see. We're certainly aware that the movie is coming out, and possibly might expect some more activity clinically because of it. But it's pretty high up there right now as it is, as far as the awareness.
What's the line at the bottom that says this activity or this incident can cause a concussion?
In our program, 70% of the kids that we see are sports-related concussions, and I can tell you that we've seen concussion in every single sport. Everything from, of course, the highest ones are football, basketball, hockey, but we see concussions in swimming, synchronized swimming, cheerleading is very common, and so you really can't get away from any sport and not see a concussion in it. We've had cross-country runners with concussions. So it really is true that so another 30% of the kids that we see are not sports-related. So these are just falls. You'd be surprised at how many kids come in with concussions where their sibling has pulled the hatchback down on their head, and so we've seen that a lot, and just slips and falls, bike accidents. In any person who's mobile, there's always the potential to trip and fall and hit your head, and so it's difficult. It's going to be difficult to get it to ever prevent these things.
With the uniqueness of every concussion, every person experiencing a concussion, does it make it difficult in the treatment?
You really hit on a very important point, is that every single concussion is different and individual, because every individual who has a concussion is different. And so it's one of the things that we really focus on when we evaluate our kids is what are their pre-morbid characteristics, what is it about them before they had the injury that could potentially lead to longer recovery difficulties, things like that. And so we really have to look at those individual characteristics in a person, because they definitely make a difference in how a child recovers from their concussion. If you sustain a concussion during the school year, it's obviously very different from during the summer break when you're not going to school. There's a lot of things about school that can make a concussion hard to recover from. And just think about the physical environment of school. Very loud, lots of lights, and those are the sorts of things that, at least initially, when you're recovering from concussion, that can be really triggers for more symptoms. Put on top of that the academic rigors that kids are exposed to now in school, and that really can be a factor in kind of maintaining or exacerbating symptoms. There can be, if you're going to be out of school for a week, there can be a lot of anxiety and stress associated with missing all of that school. And so sometimes we get those sorts of emotional reactions that really can contribute to the length of the recovery. And so contrast that to summer when you're not going to school, and what you see is the recovery times are quicker when kids are injured during the summer versus school year.
Have more schools been flexible in helping kids who are recovering from concussions out, as far as laying out a study plan or a work plan or a plan to acclimate back into the school setting?
Yes, it's definitely a learning curve. This is all new for the schools as well. I think there's still a lot of brain injury being a hidden injury. You look physically okay, but my brain is injured, and it's difficult to see what the problems are, and that's common with any brain injury, potentially. But that's one of the things that we do as a program, is we work with the schools to help get the kids back to school as quickly as they can. And I think that's really an important point, is that in our experience, getting the kids back to school as soon as possible is very important, because of some of the reasons we've already discussed. When kids are out of school a long time, it just kind of begets more problems. And so our focus is really trying to get them back into school, even if it's part-time. Getting back into the social situation of school is very important, and back kind of doing some schoolwork and getting into the flow of things.
What are you seeing as far as the difference between boys and girls coming in with concussions?
So there was a study that was done by the Minnesota Department of Health, the epidemiological unit, looking at high school concussions that occurred in high school athletics. It was published in 2014, and with that study, they estimated that statewide there were approximately 3,000 concussions that occurred in high school athletics. And what they found is that when you rank order the risk for concussion, or it wasn't actually the risk of concussion, but the actual concussions that occurred per 100 athletes, girls hockey was number one, followed by football, boys hockey, girls basketball, and wrestling. So there's certainly concussions occur in boys and girls, and it was interesting to see that girls hockey had the highest rate of concussions.
Do you know if any steps were taken since then, particularly for girls hockey? I know that there is no body checking in girls hockey, but we know that, like you said, there's plenty of room for incidents where people collide, people fall. Is there anything that can be done to curtail that or lower that number in girls hockey?
I just think it has to do with, again, we've talked about this about playing with respect out there on the ice or the field, and teaching kids at all levels about proper body contact, respecting your opponent. I think those are the things that are really going to be helpful in trying to prevent the concussions.
You had mentioned the number of kids last year in Minnesota who were diagnosed with a concussion. I imagine you could take that number and add more, because there were probably kids who never came in to be diagnosed with a concussion. What would you tell a parent who maybe suspects his or her child has concussive symptoms or is experiencing concussive symptoms, what would they do to get into our pediatric clinic?
First thing that I always tell people is that if a parent suspects a child of having a concussion, they should definitely not return to any sports until they've been evaluated by somebody who's experienced in concussion care. The vast majority of concussions can be adequately evaluated and treated by their pediatricians, by the children's doctors. Our concussion program is really here to see kids, whether it's their first concussion or whether they've had multiple concussions. We're a great resource for the pediatricians and healthcare providers in the community if they have any difficulties with kids who are recovering from their concussions. So we see ourselves as a resource for the healthcare community, and we're have clinics in St. Paul and Minneapolis at both campuses, Minneapolis and St. Paul, and we're housed in the neurology and neurosurgery programs at Children's.
Okay. And people can find that at childrensmn.org, and under services you'll find neurology, and you'll get all the appropriate links for contacting them there. Is there anything else you want to touch on? We could sit here all day and talk about concussion. Is there anything that you think parents need to know, or even kids listening need to know? I think about in my athletic endeavors, honesty is important too, for someone who may have suffered a concussion or a traumatic blow to the head, to be honest with whether it's your trainer or your coach, to not lie your way into playing.
It's a good point. So I'd say two things. One has to do with equipment. Kids and parents need to make sure that their equipment it fits well, and make sure it's sized well, it fits well, it's on properly. So it's always very important to make sure that that's looked after. I mean, I look at my son's hockey helmet on a weekly basis to make sure that everything is in place, the straps are all there.
Mm-hmm. Check for cracks.
Checks for cracks, and make sure that the mask is fitting properly, as an example. The second thing is you need to be an advocate for your son or daughter. If you suspect that there was an injury, you should feel very comfortable in communicating with the coach about it, whether it's right during the game time or not. It's just important to be aware of the signs and symptoms of concussion. There's lots of information out there, whether it's the youth sport organization sites. The Centers for Disease Control has a great set of education modules for concussion. And so I really tell patients and their parents that they need to educate themselves on concussion awareness. What are the signs and symptoms? And then don't take it lightly. The next important game is not as important as your child's health. And so take it seriously and get things evaluated if you need to.
Great. I appreciate your time.
You're welcome. Thank you for having me.
Anytime.